A urinary tract infection, or UTI, happens when bacteria invade and grow in your urinary tract. It's one of the most common infections in women. A UTI can happen anywhere in your urinary tract, which is a group of organs that make, store, and remove urine from your body. Your urinary tract is made up of upper and lower sections. The upper urinary tract includes 2 kidneys and 2 ureters. And the lower urinary tract includes the bladder and urethra. UTIs may be caused by several types of tiny germs called bacteria. But most of the time, it's caused by bacteria called Escherichia coli or E. coli. Although men can get a UTI, they are more common in women, mainly due to differences in anatomy. For example, women have a much shorter urethra than men. This means bacteria have a much shorter distance to travel up through the urethra into the bladder and cause infection. And on the outside of the body, the end of the female urethra is closer to the rectum. Bacteria that commonly cause UTIs are located here. This means bacteria have a shorter distance to spread from the rectum to the opening of the urethra. In your body, the infection begins when these bacteria enter and move up into your urethra. Some ways bacteria can enter the urethra are during sex or if a woman wipes from back to front after a bowel movement. From the urethra, the bacteria can move into and infect your bladder, which is the most common location for UTIs. There, the bacteria can enter the cells of the tissue lining your bladder, called mucosal epithelium. The bacteria can multiply inside the cells of this tissue. Then they leave the cell, killing it in the process and allowing bacteria to spread to other cells. This damage causes your immune cells to attack the bacteria and infected cells, which inflames the tissue. Unfortunately, some of the bacteria can avoid and hide from your immune cells. This allows the bacteria to grow and spread within your body. There are 2 main types of UTI: an uncomplicated UTI in the lower urinary tract and a complicated UTI in the upper urinary tract. An uncomplicated UTI is called urethritis if the infection is in your urethra. If the infection moves up into your bladder, it's called cystitis. A complicated UTI is a more serious infection that occurs if the bacteria move up through your ureters and into your kidneys. This is called pyelonephritis. The main risk factor for getting a UTI is being female, since the female urethra is shorter and its opening is closer to the rectum. Other risk factors include having a previous UTI, being sexually active, using certain types of birth control, such as a diaphragm and spermicides, pregnancy, having gone through menopause, poor hygiene, a weakened immune system from a disease such as diabetes, and having an abnormal urinary tract. If you have a urinary tract infection, you may have some or all of these symptoms: pain or burning with urination, frequent or urgent need to urinate, dribbling of urine, incomplete bladder emptying, pressure in your lower belly, or cloudy or bloody urine. If the infection has reached your kidneys, you may also have these symptoms: fever, chills, pain in your back, side, or groin, nausea, or vomiting. Left untreated, a UTI may lead to permanent damage to your kidneys and spread of the infection through your blood to other organs. And if you have a UTI while you're pregnant, your baby may be born early or have a low birth weight. Since bacteria cause UTIs in most people, they are usually treated with antibiotics. It's important to take your prescribed antibiotics until all pills are gone, even if you start to feel better. If needed, your healthcare practitioner may also recommend another medicine to relieve pain caused by the infection. If your pain hasn't improved after finishing the antibiotics, talk to your healthcare practitioner. You may have bacteria that are resistant to the antibiotics you were given, or you may have an abnormality in your urinary tract that's causing pain. Some of the ways you can help prevent a UTI include urinating as soon as you need to, urinating before and after sex, drinking plenty of fluids, taking showers rather than baths, cleaning your genital and anal areas every day, not using douches or other types of hygiene sprays, avoiding tight-fitting pants, wearing underwear with a cotton crotch, and if you're female, making sure you wipe front to back after using the toilet. To find out more about urinary tract infections, talk to your healthcare practitioner.